Okay, it's been just over a month since I had my open heart surgery. So thought I'd come on here, just give you guys an update of what's going on. So on August 26th, after 3 showers, that's how clean they wanted me to be, with the special soap, I went in for my surgery. The first thing they had to do was try to start an IV. I was so swollen and things at that point, a lot of water weight that because of what was going on with my heart. So they had a hard time starting when they tried 3 times and they called in a guy that is like a great guy at that, and he finally started an IV. And then they had to do an arterial one into an artery. I've never had an artery IV before. It just goes more directly. It's like a mini surgery actually to have that put in, as they used I think an ultrasound machine to sort of scan it and go in, and it was pretty painful. But got that done, and then I went into surgery. They hadn't shaved my chest yet, and the people in the surgery thought that was supposed to be part of pre-op. But I told them, I don't know what to tell you, it's not shaved. So they had to do it after I was out. But, so I'm laying in this room. There's like 30 people in the room, and not even the surgeons yet. And because they've got people over there that are running machines to keep me breathing and to beam my heart while they stop my heart to try to fix it. They've got other people setting up all the surgical equipment. They've got people to put me onto the surgical table. They've got all those anesthesiologists in there. And I met my anesthesiologist before the surgery, but he got called out because someone else had to have their heart replaced. So they replaced my guy. He went to that because it's a almost all day surgery, and he was on call. So he went over to that one, and then they put him in with the other guy. But they were both just as good. Just a little change there at the last minute. But so when they laid me on the table, they were putting the oxygen mask on me to put me to sleep after they had talked for a little bit. And I said, hold on, there's one thing I want to say. And they said, go ahead. And I said, I want to tell y'all to be good. And I want to emphasize this to you guys especially. Do good. God bless. And before I could say go Bills, in unison, 3 other people in the room said it with me. And go Bills. I loved it. I loved it that there was 3 other people in the room. And then someone else said, what just happened? It was very funny. Very funny. Everybody in the room was laughing. So then they put me to sleep. So it was nice that the last thing I remember is laughing at the lady that said, what in the world just happened? So anyway, so they did change put a mechanical valve in for my mitral valve, which is the one that was having the worst problems. They put another mechanical valve in for my aortic valve. Then they performed a bypass where they took blood vessel from up here in my shoulder, which they didn't have to do another incision because they already had my chest cracked open at this point. So they just went over there and took that as well, and then did the bypass on my heart. And then my doctor thought it was a good idea, so I went with him because he's the boss over there at Strong Memorial Hospital in Rochester, and he's the head guy in cardiac. So we excluded part of my heart too. I think it's part that actually doesn't do much. So to get the rest of the heart more blood and have it working right, they wanted to shut off that part. He actually told me he thought everyone that has a bypass surgery should have that done. So we did that too. So 4 things done to my heart. And then I woke up 7.5 hours later. 7.5 hour procedure. They had my neck. If you don't know, I have cervical spinal stenosis in my neck, and they had my neck leaned all the way back as far as it could go for the anesthesiology. So my neck certainly was killing me for a few days. But when I woke up, I still did have the breathing tube down my throat and the huge vessel type thing that they could shoot medication into my heart if they needed to, in my neck right into this main artery here. So, yeah, so I had that. I had watched a video before going in for surgery, and he said that when that's in, just try not to breathe. Let the machine do the breathing. Just try to relax. This video really helped. I'm so glad that I was able to watch a guy that had this done and that helps other patients that are having this surgeries done. And so he had recommended to try to remember the words of a song. So my favorite song, well, not my favorite, well, maybe one of my favorite songs anyway, is I'm Waking Up by We the Kingdom. If you get a chance, please go and listen to the lyrics of that song. My wife and I love it. We always thought it was an alarm clock playing and that we're waking up and realizing the Word of God and how special it is to be alive and to have Jesus in our lives. So I started singing this song to myself, obviously. And the song starts out with the beep, 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 which you thought was an alarm clock. And the same beeping sound was happening in the room. It was my heartbeat. Beep, beep. I mean, the machines are beeping. There's a lot of machines going off. Anyway, I realized right then, this song is not just about waking up for that reason. It's about waking up when you have heart surgery. I don't know if that's the way that We the Kingdom intended it, but it says in there, my heart is failing. My heart was failing, and then I'm lucky to be alive and alive with the living. And wow, that hit me. Then they did take out the breathing tube. And part of the breathing tube, there's a lot of liquid. They don't want that going back down into your lungs. So they hand you one of those like dental things to suck up the stuff. Dude, like I had just woken up from 7.5 hours of anesthesia, and they're handing me this thing and telling me to wipe it around my mouth. And I didn't turn it on. The person started yelling at me to turn it on. I didn't know how to turn it on. So, there's a switch on the side. Okay, so I moved the switch on the side and used it. Come on. There weren't enough people in the room so somebody could help me a little more than yelling at me while you're trying to do something else to do the liquid anyway. So I was awake and they had taken everything out. And really that wasn't that bad. I was just glad that part was over. I was in a lot of pain as expected. I would say it's like an 8 or 9 at that point in my chest. Oh, I forgot one part. Oh, no, this is right. Sorry. Then, I think it was even the next day, they wanted me to go for a walk. So I went for a walk. I went down the hallway. I had a big machine with me and my other machines. And I went down, and at the start of it, I felt okay. But then I got just like 3 rooms down and I had to turn around. My chest was beating so hard. And I was winded. I was out of air. I had to go back. And that was just a few steps. I didn't know how I was going to do this. And they gave me the breathing machine, the one they usually give you after surgery. You got to breathe in and move the ball up. I could hardly move that thing. I could hardly move it. I will say that Strong Memorial's cardiac unit's ICU unit is fantastic. Those nurses in there, I told the one nurse at the end that I was so lucky that I had her as my nurse. She did 2 of the 4 shifts that I was there for. So I stayed there 2 nights and went on to the regular cardiac unit. At that point, I still had tubes in my stomach, and they put a exterior pacemaker in just in case, and they're hoping they could take that out. That thing shocks you every time it needs to work. Because it's exterior, it shocks right where the thing is. So I was getting a little shocked, so I knew when my heart was having problems. Gradually, the walking got better, and I was able to do 3 laps around the cardiac unit before I needed to stop. Sometimes that would put me right to sleep, though. I'd be exhausted. But my heart wasn't cooperating. The upper unit and the lower part weren't timing together correctly. There was too long of a pause between beats. So they were trying to figure out what to do. They were hoping that maybe that would take care of itself, but they couldn't do anything until my blood got thinner. It was too thick to be able to do anything else. So they finally decided that they needed to go back in and put a pacemaker in. No, pacemakers just don't go back in. Excuse me for that. But they go over here to my left side and put a pacemaker in. I had to wait like 5 days for my blood to cooperate. So I was doing rehab in the hospital. Not really rehab, not like on machines or anything, but walking, learning how to climb steps, that kind of thing in the hospital for those 5 days until my blood got to the right level. And then they took me in for a pacemaker. But before they did the pacemaker, they wanted to see what was causing it a little bit. So they sent me down, they wanted me to do the full exercise test for my heart. I told them there was no way I'm not doing that. I can't do it. So, and they knew I couldn't, the people down there that run these tests. So they went to find a cardiologist and went out the hallway to see what a cardiologist would think I should do. And there standing in the hallway is my cardiologist, not my surgeon, my cardiologist. And he came in and actually ran the test. I got to a whole level of not just 1, but 2 before I could stop, and an acceleration of 2. So that's not that great, but it did get my heartbeat up to the level that it needed to go to. And Dr. Vornikowski, who is my cardiologist, would recommend him to anyone. I love that guy. He said that the test was good and we needed to move on. So anyway, after I did that test, then they put in the pacemaker. So I do have a pacemaker now. Right the next day after doing the pacemaker, remember I said I was doing 3 laps and getting winded? I did 6 laps and was fine once they had the pacemaker in the very next day. So the pacemaker made a big difference. Might have to cut this video a little bit short in a minute because my chest is starting to hurt. So my chest goes right now, usually during the day it's at a 1 or 2 level, but if I overexert myself at any point or anything, it can get up to a 5 or 6. And I think I'm about a 4 right now, but I'm going to try to struggle through it and finish this video. So when I was leaving the ICU floor to go to the cardiac wing, I was scared. I was nervous because, I'm just coming out of surgery from having my heart worked on. It was nice to be in the ICU unit with one nurse as your nurse. But we went over to the cardiac unit. They rolled me in there. And on the way, my wife got a phone call. And when we got to the room, she listened to it. And it was Reggie Gilliam calling us. Apparently, my wife had sent a letter to Reggie Gilliam. I think she sent one to Shakir and to Epinesa, those kind of guys, if they could video chat with me while I was in the hospital. And she knew it would really help me. As you guys know, I'm such a big fan. Everything these guys say to me means a lot. And Reggie we called him right away. He said to change it to video chat. We went to video chat and we talked for a little while. He said he loves the fact that I yell sledge every time he runs down the ramp or goes down the ramp. and he's going to miss that for the games that I'm going to miss. So, and then he just gave me words of encouragement, told me how good I looked. I wasn't feeling well, and I told him straight up, I look good right now because of you. I want to look good for you. He said, well, I'm not a big name like Josh Allen or anything like that. And I said, you're a Buffalo Bill. What do you mean? You're an NFL football player, a Buffalo Bill. That's huge. So I got the Reggie Gilliam jersey now. Sledge. I love that guy. He told us to keep him updated with text messages. We have been. He's been texting back as the journey keeps continuing. So after 15 days in the hospital, they kept me an extra day after the pacemaker was put in. So I was in there for 15 days, finally able to leave the hospital and come home. Another nerve-wracking thing. So when I got home, I didn't think I'd be able to lay down in a bed. So I tried the recliner. The recliner was very uncomfortable for some reason. I have a very nice recliner. Love to sit in it. That's a whole nother deal. But for some reason, it just was uncomfortable with this chest area. So I actually laid down in the bed, and that worked fine. So I'd heard that a lot of people weren't able to lay straight down right away. I was. Now I sleep on my side, usually. Not able to do that yet. I am sleeping still on my back. I've become better and better to be able to do that. Maybe I won't sleep on my side anymore. I don't know. But I regret. Anyway, and now we're home. I do have people that come, nurses have come by a couple of times to take my vitals and things like that. We had blood work done, and now my blood is too thin. Remember, it was too thick. Now it's gone the other way and it's too thin. So I have to be extra careful not to cut myself or do anything like that, because I'm not going to be able to stop it. I was having a lot of nosebleeds, maybe like 4 a day while I was in the hospital at the end. Those have luckily stopped about 4 or 5 days ago. And that's because they've got me on the blood thinner and they're regulating how I'm using it and what level to get it to. So hopefully they can figure all that out. But the nosebleeds, thank God, have stopped. And I want to thank everybody that sent me cards. I got a few cards in the mail. Boy, Angelica really stepped up. I can't believe the package that people that lived in Angelica. I don't want to say your names because, one, I don't think that's why you did it, but two, I don't want to forget anybody. But there were about 5 or 6 people from Angelica, and I want to for sure thank the group that did that. They sent me jerseys and jacket and shorts and gift cards. I mean, amazing. I even got a card from my English teacher from high school, Mrs. Tomset. Class act. I do wish I would have taken high school English, if I'd have studied harder under her, because she's a great teacher and I was lucky to have her. Anyway, so now I am obviously a big, huge Reggie Gilliam fan, and I've got my eyes set to hopefully go to my first game in November, the Tampa Bay Buccaneers game in the middle of November. Hopefully I can get tickets in another section, because my section is a little rowdy and I like it to be rowdy. I like us yelling and making noise and dancing. Not like fight rowdy or anything like that. We're just happy and celebrating things together. So I don't think I can sit with them this right away. I maybe in December, depending on weather. I'm not going to be able to go out there if it's really snowing this year. But hopefully the 2 games in November, or whatever's in November, I'll be able to attend. So, speaking of what the Bills have done so far, I was in the cardiac wing when the Bills played Baltimore, and just kept saying to myself, stay calm, just stay calm, just stay calm. What amazing comeback. An amazing game to be sitting in the cardiac wing to watch by myself. Because it was past visiting hours. Anyway, and then they took care of the Jets and they squished the fish. So now this week we've got the Saints to play. Spencer Rattler's their quarterback. And they've got a great running back too. But the Bills have a challenge in front of them each and every week. It's the NFL, and we'll see what happens with that. But big shout out to Reggie Gilliam. I consider him to be like a brother now. And I know all of you can see the resemblance that he is definitely my brother. Love you, guy. So with that, I want to remind you that God loves you. God does love you. And so do I. So be good. Do good. God bless. And go